Hi students, I'm going to go through the medicine section for CPT. This is just going to be a review from what you had last year. So let's just kind of go through a few things. A couple of different things I want you to remember. It's the last section in your CPT Category 1. It classifies non-invasive or anything that's minimally invasive. Keep in mind your surgery section is going to have your invasive surgeries where they actually make the incision and go in. Not saying that there isn't some minimally invasive, because there is, but these are going to be like your percutaneous access, um, something just real kind of minor, minimal. The other thing is you're going to have diagnostic procedures and services, therapeutic procedure and services in this section. Okay, so here's just a knowledge check. Just kind of do this. I just talked a little bit about non-invasive and minimally invasive procedures. Go ahead and check those out in your CPT medicine section. All right, and here's your answer. Okay, overview. These include codes for procedures and services that, remember, our immunizations. They are in this section. We can apply to various medical specialties as listed and different types of healthcare providers. You'll have physical therapists, occupational therapists. There is chiropractic in this section. All right, so knowledge checks, like I said, just go ahead and do those. All right, different guidelines. You do have the add-on codes. Remember your add-on codes. You can never use an add-on code alone. You have separate procedures. These could be bundled CPT medicine codes. There could be multiple CPT medicine codes. Unlisted service or procedure, remember they end in 99. Special report, we could have imaging guidance, supplied materials, foreign body, implant definition. Okay, so what is the difference between bundled and multiple codes in the CPT? This is kind of important. All right, so when we're talking bundled, okay, these are not separately coded and reported with the major code procedure. Reporting the component code in addition to that major code is considered unbundling, which is fraud. So let's go a little bit deeper into bundling. Okay, so this would be a good example, and I'm just going to pull this through. Let's say we have a diagnostic arthroscopy. With that diagnostic arthroscopy, it's going to be a code all by itself, if that's all they did. So let's say that they came in for a diagnostic arthroscopy of the knee, and they had a medial meniscectomy done. All right. What it means to bundle or unbundle is that we code the diagnostic arthroscopy and the medial meniscectomy both. When one code could be reported for diagnostic arthroscopy and a medial meniscectomy. Okay, so the other thing here, multiple procedures, services are performed on the same date. You report a separate code for each procedure or service. As you can see, there is tons of subsections in the medicine. So the best thing is take your time, study, look through the different things that can include. Remember, these are not going to be your big invasive surgeries. These could be minimally. And when I say that, a good example would be if we are in cardiovascular, a cardiac catheterization. Remember, they do a puncture, and this could be in the leg to go up to the heart. That would be your cardiac catheterization. It's minimally invasive. They're not making a big incision to go in. Same thing with other different acupuncture, the same thing. As you can see here, there's a lot of different services. So make sure, once again, you go and just familiarize yourself with it. Hemodialysis, they do give you an example of that. That's going to be minimally invasive. A stent, kind of what I talked about. Say they did do a catheterization and then they put a stent in. Same thing with the angioplasty. We're still on that. That's a balloon. that goes in there to push that plaque back. Your electrocardiograms are minimally invasive or actually not invasive. So is an echo. Talked about the cardiac cath. Scratch test for allergies. Intradermal skin test. Okay, we have anything with injections for the administration, prophylactic diagnostic medications. Knowledge check. Patient underwent an intramuscular injection, the COVID-19 spike protein vaccine. Use your CPT code and manually assign the appropriate codes. Okay, this is a great example. So with that, we are going to have 91300, which is, you're going to look under your vaccine qualifier mRNA, which is going to be our 91300 code. The instructional note says report with administration codes. Now, some of your administration codes will be in the medicine section, will be a 9000 code. All right, so don't be alarmed here if you see the 0 code. It can be very much easily a 9000 code for that. All right, so with this, we have what subsection was the most difficult for you to assign CPT codes for, section and services, what is your plan to apply CPT guidelines, and notes to those more difficult subsection procedures and services. Okay, so a couple of different things. Let's summarize this section. Make sure you know the key terms, summarize the organization, format, content, interpret your CPT medicine guidelines, assign codes from the subsection. So one thing to remember, I like to tell students, is go through your medicine section. Look at those, anything that they do immunizations for. Because a lot of times you got to decide, did they do it intramuscular? How did they give that flu shot? Okay, so flu shots can be intramuscular, or sometimes back in the, now this is probably a ways ago, that they would do through the nasal passage. So again, you're going to do the administration and the actual flu vaccine itself. So a couple of things to keep in mind. If you have any other questions on the medicine section, please let me know.